Hi, my name is Brittany. I work as a registered nurse in a plastic surgery office. There are two doctors that work in this building, so I assist both doctors during clinic. I assist in office surgery such as facelift, upper eyelid surgery, liposuction. I also run clinic. I manage the clinical staff. During the clinic, we take out sutures, we take out staples, JP drains. We do a lot of pre and post-op care, patient education before their surgeries, and then we always help them with their garments and such after surgery. My biggest source of stress in the office is probably dealing with, staff management and having to deal with reprimanding our employees more than anything, and then also taking care of patients if they do happen to get an infection, things like that. Our work hours are typically Monday through Friday, which is 8:30 to 4:30, and then we do actually get a half-day Friday at least once a month. In order to work in this position, you have to be a registered nurse. You can do that through either a 2-year degree or a 4-year degree. You have to have an active nursing license, and you also have to pass your licensure. In order to be successful, the skills you need are time management, you need to be a team player, you need to know CPR, and you also need to be able to critical think. When I was in nursing school, I didn't even realize that plastic surgery nursing existed, so that was definitely something that I didn't expect, and I do enjoy this job. It's very different than working in the hospital and other settings. This is more of a happy patient population, and I really enjoy it. The best part of this job is having happy patients and watching their transformations. You take their before pictures and then you take their after pictures and just seeing their excitement after surgery. The worst part of this job is probably just dealing with unrealistic expectations. You have patients that come in for a cosmetic result, and sometimes they just don't really realize what we can and can't do. In the hospital setting, I was more worried about med errors and, stressed about the long hours, but that's different than the office setting. My final advice if you want to be a nurse is to look into the different tracks. There are a lot of options. You can do night and weekends, you can do Monday through Friday. You can also start with a 2-year nursing degree, and once you're a nurse, you can actually go back and do your other 2 years online. So that's a really good option if you don't want to commit to the full 4 years. If you want to see if you even want to be a nurse, you can work as a nurse assistant, you can work in an assisted living facility, you can work in the hospital. And what a nursing assistant does is basically take vital signs, you give baths, but you also get to see what the nurses do every day and see if that would even be anything you want to do.